Welcome to this webinar for workers in the District of Columbia. My name is Nicola Nabel-Juris, and on behalf of First Shift Justice Project, I look forward to sharing information with you about DC paid family leave benefits when you have a serious health condition. First Shift Justice Project empowers workers to assert their workplace rights. First Shift provides free counseling and legal support to workers related to pregnancy, illness, and caregiving, ranging from one-time consultations to full representation. We also support medical providers with free consultations and trainings. Today's presentation is informational, and it is not legal advice. We encourage you to contact First Shift by phone, email, or via our online forum for legal help, as every situation is different. From this presentation, you will learn what are paid family leave benefits, when are you eligible to receive them, and how can you apply for them. First, your workplace rights depend on where you work, not where you live or receive medical treatment. This presentation addresses the rights of people who work in the District of Columbia. People who work in DC have rights under DC law, even if they live or receive medical care in Maryland or Virginia. People miss work, whether because they are sick, were injured in an accident, or because they have medical appointments. When someone misses work, at least two things are critically important. First, as a worker, you need job-protected leave. This means that when you are better, you can come back to work and still have a job. Laws that provide job-protected leave ensure you don't get fired for missing work. Second, as a worker, you need monetary benefits. This means that you need some sort of money or income in order to pay your bills. Laws and workplace policies that provide benefits make sure that you have some sort of income while you miss work. This presentation assumes that you've already received permission from your employer to take job-protected leave. Call a First Shift lawyer for a free consult or check out our resources page to learn more about job-protected leave. There are several sources of monetary benefits to replace your wages when you miss work. Paid family leave benefits, which are paid by the DC government, are the focus of this presentation. They can be combined with other benefits your employer might offer. For example, you can apply for paid family leave benefits even if you are applying for short-term disability benefits or paid time off. Employers are required to give you a certain number of paid sick days depending on how many employees work at the company. Employers can also choose to provide more paid time off through policies like sick time, vacation time, or paid time off, called PTO. If you expect to be out for several weeks or more with an ongoing condition, some workers may also have access to short-term disability benefits. These only replace a portion of your salary, typically around 60%, and may have various waiting periods or exclusionary criteria. DC has a law requiring employers to provide paid sick time, but it's extraordinarily limited. Workers can take a paid sick day to recover from a health condition or to go to a medical appointment. The law requires employers to give 3 to 7 paid sick days per year, depending on how big the business is. Your job is protected when you take a paid sick day, meaning your employer can't fire you for missing work. You should tell your employer 10 days in advance or as soon as possible in unexpected situations. For workers with serious health conditions, these days are often used up quickly. DC's paid family leave benefits are monetary payments from the government you can receive when you miss work in order to replace the paychecks you would have received if you were working. These benefits only replace your wages. They do not provide job protection. It's important to make sure you have legal rights to job protection, like under the Federal or DC Family Medical Leave Act. Contact a First Shift lawyer to answer questions about job protection. Paid family leave benefits are intended for when you have a serious or severe illness or injury. For example, if you have cancer or need surgery, paid family leave benefits are most appropriate. For a minor illness like a cold or strep throat, you might be entitled to paid sick days from your employer. Call First Shift to learn more. The DC government has a broad definition of what is a serious health condition. Here are some examples. Any condition that made you spend 1 or more days in the hospital or a treatment center, such as for an infection or severe injury. Illnesses or injuries where you can't go to work for more than 3 days, or you need ongoing medical care by a medical provider, such as a broken bone or a disease with a long recovery. Any condition that requires surgery or treatment from a medical provider, such as chemotherapy or reparative surgery. Chronic conditions that require medical care and you sometimes can't work, like a flare-up of diabetes or depression. And pregnancy. For questions about pregnancy and paid family leave benefits, check out First Shift's resource page or contact us for a free consultation. If you have a serious health condition, there are several different situations when you can receive these benefits. Examples include when you miss work to recover from your illness or injury, to receive ongoing treatments for your illness or injury, to attend regular appointments or counseling sessions related to your condition, or to attend therapy appointments. It's important to note that you cannot receive paid family leave benefits when you miss work for regular or preventative medical appointments, like annual well visits or dental cleanings. You can receive benefits if these appointments are related to your underlying health condition. You may be able to take a paid sick day for routine or preventative appointments. In order to apply for paid family leave benefits, your medical provider must fill out a medical certification form. A medical provider is any licensed healthcare provider treating you. Sometimes it can be hard to get in touch with your medical provider, or they take a long time to complete paperwork, so ask as soon as you can. For unexpected illnesses or injuries, ask your medical provider to complete the form as soon as possible. Your benefits might be delayed or denied if you wait too long to apply. For chronic conditions, talk with your medical provider about completing a form periodically if you are having regular flare-ups or intermittently applying for benefits. You will likely need additional documentation to make sure your employer holds your job for you. Here are some helpful tips for applying for DC paid family leave benefits. Notify your employer at least 10 days before you miss work, or as soon as possible. You will need your medical provider to complete forms. This will be different than the medical forms you need for job-protected leave. Your employer must provide information about paid family leave benefits to you, but the DC government decides if you receive them and in what amount. You can combine benefits from the government and your employer. Apply to the DC government's Office of Paid Family Leave after you have a reason to miss work and before you take time off work. If you are already on leave, apply as soon as possible because you can't get benefits for leave taken more than 30 days before your application. You may be allowed to take job-protected leave by the hour, like for medical appointments, but you can only receive paid family leave benefits by the day. For more details, check out First Shift's resource page with information about applying for benefits. You will receive benefit payments approximately 1 to 4 weeks after you miss work and applied for benefits. Paid family leave benefits may replace up to 90% of your salary. It's possible that you might receive less than 90% of your salary because there is a cap to the benefits amount, which changes annually. The paid family leave benefits payment schedule is every other week. This schedule might be different or behind your usual paycheck. You can choose to receive these benefits either through direct deposit into your bank account or through a prepaid debit card. Each situation is different. Here are some questions a First Shift staff member might ask you to determine if you're eligible for DC paid family leave benefits and how much you will receive. What is the general reason you are missing work? For how long do you plan to miss work? How long have you worked in DC? How many hours per week do you work in DC? How long have you received your current salary? Have you received paid family leave benefits before? A First Shift lawyer can also help you determine if you are eligible for job-protected leave. A reminder that it's critically important to have both job-protected leave and monetary benefits, but it's very possible that the laws would provide you with one and not the other. Even if your employer holds your job, it doesn't help if you can't pay your bills without a paycheck. And if you receive benefits from the DC government when you miss work, that doesn't help if you were fired when you were away from work. Every situation is different. Contact First Shift Justice Project to speak with a lawyer about your situation. Thank you so much for learning more about paid family leave benefits when you have a serious health condition. We hope this information is helpful to you if you work in DC. If you have questions or you would like legal advice from First Shift about your specific situation, please contact us. Email intake@firstshift.org. Call our intake line at 202-644-9043 or fill out our web intake form. Thank you, and please watch our other webinars for more information.